Hi everyone, here's the question of the year. How can we protect our healthcare workers in this time of need and contain the spread? Data from various reports across the world shows that healthcare workers are becoming patients. Should we keep waiting and brace for impact for when multiple healthcare workers are infected and few healthcare workers are left to treat the patients? Or should we set them up for success by limiting their exposure so they can continue to take care of infected patients? Let's take a look at some root causes of why healthcare workers become compromised. There is a well-known PPE supply shortage, and as a result, alternative PPE is used, which is not as effective. Even with the right PPE, healthcare workers are not completely isolated, as treatment requires close contact with patients that can lead to transmission of the virus. In addition, patients are not always isolated from those who are uninfected, especially as the crisis worsens and our hospitals begin to overflow. Preserving the health of our healthcare workers matters, as a shortage of healthcare workers at this unprecedented time would lead to overworked staff. Furthermore, some healthcare workers work at multiple locations, hence increasing the risk of community infection rates. Hospitals are and will be overloaded without adequate space for patients, but we also need to maintain regular hospital operations for the other critical patients. Our collective goal should be to maintain regular operation of the hospitals, such as deliveries, surgeries, and training, while supporting COVID-19 patients and reducing the probability of infecting healthcare workers. To accomplish this goal, we must isolate affected patients from those unaffected, and hence ultimately reduce the viral spread while maintaining adequate staffing levels. The solutions are simple and feasible to implement within weeks for several hospitals. The first part of the solution is to place testing trailers with breathing air suits for healthcare workers outside the hospitals. This stops COVID-19 patients from walking into the hospitals for testing, which also eliminates exposure to unaffected patients and healthcare workers. In addition, the individuals remain isolated within their vehicles, which eliminates frequent decontamination of hospital rooms. In addition, breathing air suits can be laundered unlike regular one-time use PPE, therefore reducing the demand for PPE. The second part of the solution is to place portable ICU trailers with breathing air suits for healthcare workers outside the hospital. All the benefits of solution number 1 applies here, and in addition, solution number 2 will isolate critical COVID-19 patients from regular hospital operations. Additionally, healthcare workers are isolated due to the breathing air suit. This will reduce decontamination efforts in ICUs, and regular surgeries can continue without the risk of infection. A little bit about the suits. They have existed since the 1970s for nuclear power plant workers to protect them from tritium gas and loose contamination hazards. The suit stays at positive pressure and hence do not allow anything to enter the suit. When innovative solutions pay for themselves, they catch velocity and are implemented faster. That is the case for these solutions, as they save labor hours and materials spent after decontaminating testing rooms in the hospital, reduces waste of one-time use PPE, and most importantly, saves healthcare workers' lives for continuous smooth operations of the hospitals. If further budget adjustments are required, donations, GoFund accounts, government help, and collaboration with large organizations can be arranged to support this initiative. In order to implement this plan, there are ready-made material suppliers to make these solutions happen within Ontario. Office trailers could be supplied by Wilscott, breathing air trailers could be supplied from Jordair or at Gastech, and breathing air suits can be supplied by Abraflex. Assembly of the materials are simple for employees of nuclear companies, as they use these suits for daily operations. We are here to help hospitals accelerate the use of portable ICUs with breathing air suits to contain the spread of COVID-19 and save the lives of our healthcare workers. This feasible solution requires approvals and collaboration between hospitals, governments, and companies from across the country. We are all in this together. This is what needs to be done. Hospitals need to state that they need these solutions implemented. Simultaneously, the media must help us reach all suppliers across the province to donate or sell materials at no profit. Companies like OPG, Bruce Power, and Abraflex need to donate rubber suits, and companies like Tetra Tech and ES Fox need to help assemble the trailers, breathing air compressors, and suits. Computer-based training must occur to instruct workers on how to wear the suit and connect the hose. Adjacently, hospitals should place ICU equipment in the trailer to begin use. If we do this, we can save lives in Canada. Please like and share to show your support for this solution.